Let's get the view from the front line. Katie is a junior doctor in London, represents the Doctors Association UK. And Katie, tell us how you're viewing this when you hear those record figures announced today.
So I think all of us are terrified about what the next few weeks holds. Many London hospitals certainly are full or nearly full, and are really struggling at the moment. And we haven't really seen the people come through who've contracted COVID infections from mixing at Christmas, because we know that that takes a few days. I think the next few weeks are going to be really, really difficult, and we need to be clear about what we're talking about and what protecting the NHS means, which is trying to maintain a situation where people are able to receive medical treatment. And I think it's looking very, very concerning. We obviously want to prevent any deaths which are preventable, but that requires there to be ambulances for people to get to hospital. It requires accident and emergency departments that have capacity to admit people from those ambulances and beds in a hospital to admit patients to. And if this level of daily new infections continues, people are not going to be able to get the medical care that they need.
You're saying there's a serious danger of services being overwhelmed.
I think many of us feel, in London, that there's a risk of that, in the coming days. And if infections continue at this rate, I mean, that's an absolutely enormous number, isn't it, that you just said? It's terrifying, and I think people really need to understand that what we're talking about is making sure that, you, your parents, your friends can go to hospital if you need treatment, and that there will be capacity to look after you. And I think the message is just so important. Don't wait for there to be, further announcements and rules. Everybody can choose how to act now, and I think not having large numbers of people mixing on New Year's Eve is absolutely crucial, because I think that will be an extra burden that the system just can't accommodate.
Yeah, I bet you and many of your colleagues will be bracing yourselves for that. I wonder about the physical toll and the psychological toll that this takes on staff. Morale already challenged, but knowing that these sorts of numbers are happening now.
It's really distressing, and I think everybody goes to work wanting to provide the very best care for their patients and to look after their patients, how they would want to be looked after themselves, or for their family members to be looked after. And the more resources are stretched, the more difficult that becomes. I think it's really important not to lose sight of what awful situations people are in, saying goodbye to loved ones on iPads. It's very challenging. There needs to be limited visiting in hospitals. None of these things have gone away, and none of them are any less awful than they have been, for the rest of the year and in the first wave. And I think people are very exhausted, and a lot of people are quite traumatized.
And you clearly are understanding what it's like for somebody to be brought into a ward and being a patient. But on the other side of it, staff shortages must increase the pressure. I mean, we hear that there are, 40,000 nurses short of where you need to be in terms of the numbers to cope in a normal period of time at this time of year, never mind with the COVID crisis.
Yeah, I think people are working incredibly hard, and some people are at sort of breaking point. People need all the support that they can get, and I think the kinder you can be to NHS and care staff, the better. People are working in really, really challenging conditions, and even in hospitals where there aren't staff shortages, it's very difficult to manage with normal staffing, because there are a lot of patients who are just more sick than patients on wards would normally be. And so, even where there aren't huge gaps, actually it's still a challenge, and people are receiving quite intensive therapies on wards, which, often traditionally would be delivered in high dependency units and intensive care units. And so I think it's hard to emphasize enough how hard people are working just to keep things going at this point.